And now, Wellness Wednesday, brought to you by Dr. K.
And Dr. Kara Tolson is here with Dental Care of Baltimore, back for our Wellness Wednesday. Welcome back.
Thank you.
So we're talking fluoride today.
Yes.
You know, all growing up, that was every commercial, fluoride, contains fluoride.
Yes.
And I don't know that so many, or many people know really what the true reason or benefit to fluoride is.
You ready for a little biology lesson?
Yes, I am.
Okay. So our teeth are made of enamel, and enamel is actually the strongest, hardest substance in our entire bodies.
Okay.
That enamel has minerals. And so acid-producing bacteria that's in our mouths will erode and pull those minerals out, making them prone to cavities.
Okay.
So fluoride, how it works, it puts those minerals back into our teeth to make them more resistant to those acid-producing bacteria.
Okay. That was
easy
yeah,
enough.
Really.
Thank goodness we have you here
Pass
to
that
explain
test.
it. Yes. So, you know, we hear fluoride a lot these days in the news, and we're talking about long-term exposure to fluoride.
Yes.
Are there any health risks actually related to it, or could you explain more on that?
Yes. So there are lots of bodies of evidence that support that fluoride is safe at recommended levels. But as you pointed out, at higher exposures, long-term chronic higher exposures, you will see some potential adverse health effects. One good example of that is fluorosis in small children. So small children who are exposed to excessive amounts of fluoride, you'll see spotting on their teeth, white or brown spots. So the fluoride is actually in excessive amounts having the adverse or the reverse impact that you want. And then in countries where there's really high levels of community fluoride in the water, you're seeing skeletal fluorosis. So you'll get joint pain, bone deformities, even some thyroid dysfunction. But it's really important to understand that those studies are in populations with really excessively high amounts of fluoride.
Okay. And on a daily level, I know some water sources have fluoride in them. We always hear that, but there are lots of, you know, kind of misnomers around now. What's the best way to just kind of have a normal, you know, dose of the fluoride? Is it water, or is it just a toothpaste?
Sure. So toothpaste, that, you know, over-the-counter toothpaste, those are all very safe. Just don't eat the tube of toothpaste.
Right,
You got to
like
watch
kids
these
do.
kids.
Yeah.
Yes. The fluoride varnish that the dentist applies on your teeth, and we recommend that once a year, especially for patients who are high risk for developing cavities. And I say to patients who come in and they're skeptical, you know, because they hear these studies of these adverse impact. It's really, the key is dose, right? Toothpaste over the counter used as directed. Fluoride in drinking water in the U.S. is safe. So using it in the recommended dosage is very safe, and it's very beneficial to protecting your teeth.
Sounds good.
Yeah, Dr. Kara Tolson. And for people, where can people find you here in Maryland?
So we're located in Owings Mills at the LifeBridge building in Foundry Row, right next to the Wegmans, or you can find me on drkaratolson.com.
All right. Thank you very much, Doctor. We see you every first Wednesday of the month here
Yes.
on Wellness Wednesdays.
Thanks for having me.
Thank you as always.
Wellness Wednesday on WJZ at 9 is brought to you by Dr. K.